This course is very, very practical. We've taken a decade of trial and error to develop the protocols that can be applied consistently to any practice. If you take our course, you will learn the systems so that you can replicate in every patient the results that we have.
So I came to Redwood City to hear Dr. Simon Wong and Sandra Kahn present their GoPEX posture program. And I believe that in my profession, we're really good at all of the little things we do to people, except we have a blind spot, and that is what are we doing to help them change their posture, which affects everything else we do in orthodontics. And I don't know where anywhere else is teaching something like this that I could use on every one of my patients.
My background is I've taken orthotropics, I do practice ortho, I've done fixed, I've done Invisalign, I've done it all, but there wasn't something that I could find that helped kids, keep retention, help kids breathe better, learn better. They're gonna have proper posture. In this day and age, every 2 to 3-year-old I see has an iPad with their mouth wide open. It's very common these days. That poor posture starts early, and poor posture is leading to malocclusion as well. Simon and Sandra are helping us help younger kids to develop the proper posture, to learn how to hold the iPad properly, how to sit at a table properly, to help with the oral posture and keep the lips together.
First of all, you're learning how to use the GoPEX book. And the biggest thing is we're trying to inform kids and parents and everybody is about good oral rest posture. That has never been talked about before in general orthodontics, and the reasoning why people have crooked teeth. So if we can just get that message across of the good oral rest posture, that's a huge breakthrough. And again, with the importance of nasal breathing, getting rid of breath, especially at nighttime. Then the next step is proper sleep. We want the proper time, but also we want the proper restoration of breathing, of sleep, so that the kids can have a good day the next day. If they're not sleeping properly, everything's going to fall apart. And this is where early treatment with expansion can help greatly.
Forwardontics is really the key to everything. Everything is forward. Airway is a buzzword right now. Everybody's talking about airway, snoring, sleep apnea, all these problems that are a modern epidemic today. The key to prevention, not to cure, but prevention, is to use Forwardontics to your advantage. Use the skills and the programs that we've created to guide your patients to live in an environment that's conducive to a healthy airway. I've been practicing airways-focused orthodontics for about a decade. And now I've changed my practice to do only Forwardontics, which is the umbrella that encompasses all the techniques that help us with posture, with breathing, and with the mechanics necessary to achieve the best possible results for your patients.
I was incredibly surprised by the GoPEX component, the module. Sandra did a great job with her explanation as to how it works, why it works, Simon filling in the blanks as to how we created this. Really impressed by the outcome of its treatment. For me, it's really the game changer in the sense that I really have struggled with certain finishing techniques. I've been doing this for 20 years, but really still struggling with certain things. And I'm appreciating how myofunctional therapy and GoPEX and their complement, I'm really appreciating how it's starting to fit into I can see how it's going to start to fit into my treatment protocols.
Probably, I first heard the tropic premise and about posture in 2002 from Dr. John Yu, and I've been talking with patients or giving it lip service, pun intended, since that time, and giving them information. But giving people information is kind of like, yeah, here's information on a diet, without helping them make decisions and change their behavior on how they eat. Same thing, I haven't had a system in my practice to help the human beings that come in and their parents change their behavior, meaning how they hold their jaws, their posture. That affects everything I do. So the unique thing I'm seeing here is that aside from just having good information to give people, is how to implement a system to get people to choose those changes that'll then affect how they grow.
This course is really about the essence. We'll give you the tools, but you have to come and sit and understand what the essence is. The backbone of good oral posture, the backbone of health for your patients is really understanding how we can impact these patients to change their life so that they have habits, that they live in an environment that's going to be conducive to growing their jaws properly.
Es un conocimiento que tendría que extenderse mucho, porque es posiblemente todos los que tenemos hijos acabamos llegando a este tipo de cursos de ortodoncia porque nos preocupa cómo hacérselo a nuestros hijos, con lo cual si es lo que queremos para nuestros hijos, debería ser también lo que queremos para nuestros pacientes. Simon es un profesional muy científico, muy competente, es una persona que estructura muy bien las clases, y Sandra es una persona muy cercana que te da todo lo que sabe, con lo cual merece mucho la pena el curso. En general, yo creo que en todos los países del mundo ahora hay una sobreexplotación de clínicas dentales. Entonces, la forma que puedes tener de defenderte de la competencia es precisamente especializarte en algo que los demás no sepan hacer. Y este curso te da la oportunidad de hacer un tratamiento ambicioso, diferente y con mejores resultados. Y esa es la opción más interesante.
I would recommend coming to FORWARDONTICS if you're a person who has an open mind to thinking of the body as a whole mechanism, not just as moving teeth. I think that if you just want to move teeth, this may not be the institute for you, but I think if you want to look at the whole body, treat them as a whole, really make healthy patients at the end, I think this is where you need to be.
I would say the GoPEX is something that every dentist should have in their armamentarium, because everything that we do in dentistry, whether it's disease control, periodontal, as well as facial growth and development, obviously in orthodontics, is affected by vest oral posture, breathing, and the habits. And basically as humans, we don't come with an instruction manual. And this is an instruction manual that we can gift to people that if they're too old, well, at least they can start now, but for their kids, their grandkids, and just help people grow better.
These programs are based on compliance. You have to choose the right family, the right kid, the right environment for them. And you need to provide tools so that they can succeed in the process. You can't tell them to do something and then not give them the very specific steps to achieve their goals. So come to this course, learn about FORWARDONTICS, learn how to implement it in your practice, and absolutely make it something that can be followed by your patients, by your staff, and by you in a way that is kind and respectful.